Hello everyone, I'm Professor Dr. Suat DOÐANCI. I am a specialist in cardiovascular surgery. Pelvic venous disease, also known as the hidden disease of women in particular, is a vascular disease of the ovaries that occurs most often as a result of visible veins in the veins we call the internal iliac vein, which collects the blood of our organs such as the uterus, ovaries, and bladder inside the abdomen. Apart from this, especially among the public, there's a situation called vein-to-vein overlap. This situation may be in our stomach. It can occur after pressure is exerted on the veins by various arteries located in our abdomen. The most important symptoms of pelvic disease are a dull and uncomfortable feeling of pain that settles in the groin, which we call chronic pelvic pain, and creates constant discomfort that persists for long periods, such as 3 to 6 months, regardless of menstrual periods. In addition, the pain that occurs, especially after sexual intercourse, manifests itself in the form of varicose veins formed in the genital areas, leg varicose veins that differ in distribution from normal varicose veins formed on the legs, and side pains that manifest themselves on the side of the torso. The most crucial diagnosis of pelvic disease begins with listening to the patient correctly the first time, because patients with pelvic disease mainly come to us having met with doctors from many different branches before coming to us, and they can't get any results from the doctors they go to, especially after the examinations of obstetric extensions, when there is no pathology in organs such as the uterus and ovaries related to gynecological diseases. One of the first diseases that come to mind in these patients should be pelvic disease. When your patient comes to you, when you listen to these complaints and opinions from other doctors on the patient's history and hear a story of inconclusive examinations, this should be stored in our minds. The presence of varicose veins showing abnormal distribution on the legs in the physical examination, varicose veins in the genital area, pain where you have done the abdominal examination, especially in the ovary region, makes us aware of this disease. Our patients receive ultrasonographic scans in primary care after raising doubts about the issue. Here, the status of the disease is understood by ultrasonography performed both through the abdomen and the transvaginal. The diagnosis is clarified after the tomography or MRI examinations, as well as vascular radiographs. Complications of pelvic disease, especially in people who have had the issue for a long time. Very severe pain occurs when walking, standing for a long time, sitting, and having bowel movements. These pains can cause patients to be unable to maintain their daily lives. In more extreme forms of this, these people also start to move away from sexuality because patients feel very severe pain, especially after sexual intercourse. It can lead to the breakdown of family unity and the emergence of domestic unhappiness. In this case, it can cause serious problems for our patients both socially and psychologically.